May is Mental Health Awareness Month. Joining us today, we have Greg Dicharry, filmmaker and mental health advocate, and Dr. Rosalynn Thyssen, another mental health advocate and founder of the Traeh Thyssen Have a Heart Foundation. Thanks for joining us.
Thank you.
Thanks for having us.
So I've seen you guys out in the community before with mental health, and we just wanted to bring you in to talk about mental health awareness. And it doesn't just start in May, it's a all the time thing. And Greg and Dr. Thyssen, y'all know about that firsthand. Greg, tell me a little bit about your hand and footprint that you have in the mental health community.
Sure. So it's been great for the last few years. I've been doing work in Ascension Parish here, under the leadership of Parish President Quintmall. Y'all have had, as you know, a big push around mental health. I directed a film called My Ascension, which is around Emma Benoit, who's a young girl at Dutchtown who attempted to take her life and unfortunately was paralyzed from that experience, but it's really become a huge national mental health advocate. So, and I got involved in all of this through my own personal experience while pursuing a film career in Los Angeles, and I had a mental health episode and was hospitalized, and thankfully with family support and good support from professionals, able to live a good life. And although that film career was diverted for a little bit, got to do a film with Emma and a couple of other films. So.
And so your own incident and your passion blends together. Tell me about that.
Yeah, so initially, like I said, I was pursuing a film career in Los Angeles, was directing a film. Just kind of the excitement of that was kind of spurred the episode, and then kind of had continued struggles directing other projects, and so then kind of my career was diverted into mental health. So I started working in mental health and, really developed a passion for that. I started a youth program, which I did for like 15 years, helping youth and young adults who were experiencing mental health challenges, foster care challenges, really showing them that even though they have these challenges, they can still, succeed and be successful if they're willing to, put in the work and, utilize the supports to change their lives and, and have a good, successful life.
And I ask that because a lot of the times experience drives passion, and experience drives how people get their hands into mental health. And sometimes it's an experience with a loved one, and sometimes it's an experience with ourselves. And Dr. Thyssen, you met Greg from his hand in mental health, but you have your own experience. Tell me about that.
I do. So I've always been a mental health advocate, but it didn't become personal until my 13-year-old son died from suicide after being bullied. So I've always, wanted to help. I wanted to have my hand in mental health care, but again, it did not become personal. It didn't really hit home until it hit home and my son died.
Greg talked about having family and friends kind of help pull him out and lead him into where he is now. You're the family member who lost a child. Tell me about where Traeh was mentally, or did you see any signs? Why is mental health awareness prevalent?
I can say whenever Traeh first died, I was kind of angry with him because I'm a nurse, I'm a nursing professor. I teach about mental health and suicide awareness, and what Traeh displayed was not the telltale signs of someone who is at risk for mental health issues or even suicide. Yes, he was bullied. He did tell me about the bullying, but what he did not do was tell me about how bad it made him feel. He never told me that he was thinking about taking his own life. And it was at that moment that I realized I thought he told me everything. A lot of young people who do deal with mental health issues, concerns, or crises, they don't talk about it, so they suffer in silence.
And so from that, very strong mama, by the way, thank you for what you do. You decided to start a foundation to then look at other children so that this won't happen repeatedly. Tell me about Traeh's Foundation.
So I have a new phrase, I yield to the youth. So it was actually my four remaining children who pulled me out of the sunken place, because when he died, grief was taking its control of me, and I was having my own mental health concerns and crises, depressed, angry. I was withdrawn. I didn't want to eat. I didn't talk. And it was my kids who said, "Mom, Before Traeh died, he lived, and we have to do something so he continues to live. So we started the Traeh Thyssen Have a Heart Foundation. His name is Traeh. His heart spelled backwards, so I have my heart glasses. Anytime I say his name, I want to say that because when we think of hearts, we think of, things that are loving, caring, and he was all of those things. So we say have a heart because we want people to understand that we have to have a heart for people. We have to show up for people. We have to be compassionate. We have to understand that mental illness, mental health concerns are something that is real. They may not be displayed like we want them to be, but we still have to be aware and we still have to be ready to intervene.
That's powerful. And so, how important are resources? You said that Traeh didn't really display the signs that you would have thought he would have displayed. He didn't tell you everything. What can resources do to kind of bridge the gap of people who may be feeling a certain type of way but may not be able to express that to their loved ones who are right there?
So after Traeh died, I learned about so many different resources. After he died, I learned about NAMI, the National Alliance of Mental Illness. I learned about the American Foundation of Suicide Prevention. I learned about youth mental health first aid training, ASSIST. I learned about all of that after the fact. And I wish I would have known that before. So our goal with our foundation is to bridge that knowledge deficit, bridge that gap to let people know that there are resources here. And had I taken some of those trainings or classes, even outside of being a nursing professional, just those extra things, knowing how to pull things out of kids, knowing how to look at those subtle signs, maybe he would still be here. I don't have that opportunity, but what I do have is the opportunity to share that knowledge, to share those resources with other people.
And she was, provides a lot of resources herself. We were both at the Capitol yesterday. There was a youth day at the Capitol focused on mental health. So there's a number of youth organizations in the state. One is called Hope Squad. One is Peer Initiative, where it's young people at high schools who are trained in suicide prevention and are there to really support each other and support their peers. And they were down there, touring the Capitol, learning about their government and meeting with some legislators. And Dr. Rosalynn was down there with some other organizations sharing information with resources with the students, but also, with the staff and the elected officials.
And is there a one hub that has links and resources that are available for people who just are lost and they just want to get started somewhere?
I know our foundation does. So on our website, we have a resources link, and all the different resources that I learned about, we have on there. I do believe that NAMI also has a hub that has resources as well. Greg is a walking resource.
Yes.
I don't know if he knows that he is a walking resource.
Yeah, and she mentioned most of those because they are local, organizations. There's, Mental Health America is another one that has chapters locally, and her website would be a great place to look at those. So yeah, there's a lot of resources out there, and one is 988. It was formerly the National Suicide Prevention Lifeline, which was a 10-digit number, but through lots of different advocacy and legislative action, they came up with the number 988. So rather than the 911, which is for really crisis in the police, 988 takes you directly to a trained counselor who, and it's all routed to the different areas. It's a national thing, but an organization here called Via Link, they operate it for this area. So you call there, you can call there as yourself, you can call for a friend, you can call for a loved one, and they have information on resources in the area. So that's a real good, easy place to call. You can call or text 988.
And that's great, Greg. Thank you so much. We'll list all of this, on the screen because we want people to be able to have access to mental health resources. And you called Greg a walking resource. I thought of the word purpose when you said that because you're still here.
Yeah.
And now you have a purpose to help other people who may be feeling like they don't want to be here. And as well do you. Purpose was birthed from sadness.
From struggles. Yeah, and one of
struggle.
the things that really is inspirational to me is Miss Rosalynn and some other advocates who never knew they would become advocates, but they've lost their, child, and they've become very passionate. Miss Poche, who was also at the event yesterday, lost her daughter Karen, who's actually, that you see that in the film, My Ascension. And it's just, I can't imagine. I have a 9-year-old daughter. I can't imagine the pain associated with losing a child. And to me, it's like, breaks my heart to, hear that and know their story and experience, but also is so inspiring that they're willing to kind of relive that on a daily basis because they know that their experience can help save a life or save a family, educate a family, so they don't have to go through what she went through.
Definitely having a heart, being there for others, and making sure that these resources are available and spoken up about. That is what mental health awareness is about. And I really want to end with you, Dr. Thyssen, saying it's Mental Health Awareness Month, but what is mental health awareness?
Whenever we think about physical health, we always say things like, oh, it means having a good blood pressure. It means that we have a good heart rate. But when we say mental health, we automatically jump to the negative, automatically. But the key word is health. So we need to focus on those things that keep us healthy mentally and emotionally. So that means, am I going to have some bad days? Yes, that is normal. But being able to have the skills to cope with those bad days, to have that resilience to move forward, I think a lot of that is mental health.
Definitely. And Greg?
Yeah, I mean, really, mental health awareness should be every month. And I think as we've, progressed in the last number of years, it's become not so much of a taboo topic. But I think Mental Health Awareness Month is a way to just draw more attention to it and let people know that if they are struggling, to reach out for help, to let people know there are resources out there that they can utilize, and to, let people know that they're not alone. And so that's kind of, I think, the biggest thing is the resources to let people know that if you are struggling, or you may think you're struggling, to reach out for help. Because a lot of times, and that was even my issue early on, I was struggling or feeling kind of this depression thing, but I didn't know what it was, so I didn't reach out for help. And so there's a lot of stigma around reaching out for help because people think that they're gonna, be looked down on or be bullied, or people are gonna think they're crazy or whatever, so then they don't reach out for help. And I just always encourage people, even if it's not a huge issue at the time, or if even if you just feel a little off, or you maybe have a child that you kind of seeing some signs that they're changing and stuff, go see professionals, get it checked out. It's better to address it earlier than, later when it becomes much more of an issue.
Definitely. Mental health is just as important as your physical health. Thank you so much for joining us in the studio today. Dr. Thyssen, what is the website address for Traeh's Foundation?
So it is ihaveaheart.org. So whenever you type in the website, you are proclaiming, you are stating, I have a heart. So I thought that was pretty awesome.
Definitely.
So it's ihaveaheart.org.
All right. Thank you so much for joining us. Thank you so much for doing what you do. And thank you so much for you both being advocates for mental health.
Thank you.
Thank you.
Okay. Like Dr. Thyssen said, ihaveaheart.org to view more of the Traeh Thyssen Foundation. And if you or someone you know is struggling with your mental health and you need to call someone, please do not hesitate to reach out to 988. That is the suicide hotline prevention. Thank you, and we'll see you next time.